So, hello, Fred. How are you?
Hey, Naz, I'm good. Greetings from London.
Great, great. How are you doing? How is it going in London?
Great. It's all right. Probably a very common thing right now globally, if you're not in Sweden or Iceland, that you're on a lockdown and spend a lot of time at home.
Yeah, same in Istanbul. We are in lockdown for quite a bit now. So I think we can
Yeah, it's unfortunate.
start our first live webinar on Learn Liberty. Thank you for joining us today. So I will be your moderator. I am the educator. I will be. Is everything all right?
Looks good.
All right. So I am the Education and Trainings Manager of Students for Liberty, and I'm also the content creator for Learn Liberty. Fred is the Managing Director of Consumer Choice Center, and I will now give him the floor. Can you please explain your consumer case for intellectual property, Fred, and also introduce yourself in a much better way?
Yeah, thank you so much, Naz. Yes, I'm Fred Roeder. As you will probably hear throughout this webinar, I'm originally from Germany. I studied health economics in Germany. I'm very interested in the economics of health systems across the world. My focus in my first years of my professional career was to look at how the transition from a planned economy, from socialism to a market economy works within health systems. So I worked on modernizing, privatizing, and liberalizing parts of health systems with a strong focus on former Soviet Union. Worked on the privatization of hospitals in the Republic of Georgia, on hospital modernization in Azerbaijan, did some work on Romania, some work in the Baltics, Czech Republic. So learned many things. And then after a couple of years, mainly focusing on hospitals, I also started looking more at health policy in general and advocacy. And for the last few years, I've been looking very much in the field of innovation in healthcare, because something I will probably mention a couple of times throughout the evening is that so far, despite all the medical breakthroughs we have, we can only cure and treat about 5% of all diseases that are known in humanity. So 95% of diseases, we still have no clue how to treat them, and especially how to cure them. And therefore, there's a massive case to make that policies should really look at how we can foster innovation, how we can bring more inventions and innovations to patients, and what the best institutions are to foster this. And my case is that intellectual property and incentives for inventors. Intellectual property, a patent, for instance, is a great incentive that if you invent something, you own it afterwards and you can monetize it and return your very risky investments. And therefore, I make the case for the consumer case for intellectual property. Maybe just very quick, right now I'm working at the Consumer Choice Center. I'm the Managing Director of the Consumer Choice Center. And among the four policies we work on, science and innovation is one of them. And that's something I've been writing quite a bit in the last 12 to 18 months. We published a report at the end of last year on the consumer case for intellectual property. And since then, public health has become like a really big issue, given all the COVID-19, Corona, however you want to call it, problems we have. And that's something I want to talk about. So maybe should I do a quick introduction of my thesis?
Yeah, please. So first, give us a bit of an idea, and then I'll push you more with the questions, probably.
Absolutely. So this year actually marks the first year in human history where we have more people that are older than 64 than we have people younger than 5. So we see a massive shift in the distribution of age groups. It's also called the demographic change. And this is, first of all, good news, because over the last century, we're able to have better innovations in health. We can cure more diseases. We have better access to food, to clean and safe food. And we have innovations also in biosciences. We're able to extend the life expectancy of humans. And we, average consumers, are the main benefactors of this. These innovations and scientific breakthroughs actually provide the best and most sustainable solutions to challenges humanity faces. So until early this year, the biggest challenge which drove most people was climate change. Right now, probably most people are more concerned about epidemiological problems, such as the coronavirus. I mean, there's a big awareness now on what viruses are out there and how little we often know as humans, and even as the scientific community knows very little, and they first need to go on a discovery process to find innovations or to innovate to tackle these problems. And especially the private sector is the driving force to provide solutions to problems we're facing. And at the same time, you can see in this crisis where we actually all just hope, when is the vaccine coming out for the coronavirus, and what medicines, maybe which are already on the market, can we use for the clinical trials? And politicians are trying to make statements on if the vaccine's still coming out this year, when can we mass produce it? Is it something coming next year? And usually people look at companies or even testing kits. How fast can a company like Roche or Abbott produce all these testing kits? At the same time, you see activists that now shout, oh, no one should be allowed to make money out of this crisis. And we should not allow any patents for these innovations. Obviously, this will lead to the fact that there is no incentive to quickly innovate if you cannot monetize it afterwards. So maybe before I talk a bit more about the details of intellectual property, I just want to talk a bit about some things we can be really thankful for in the field of scientific innovation. And I recently asked a couple of friends on social media what they think, what medical breakthroughs have been really significant in the last 2 decades. So I'm 33, so the last 2 decades I was fairly aware, like from age 13 on. I think I was able to kind of follow at least partially what's happening in the world through my TV and later on through my social media feed. And I already mentioned that we so far can only cure 5% of all known diseases, but in the last 20 years, there was some very significant improvement on this. So just one very recent improvement is the so-called immunotherapy to fight cancer. So basically what researchers do, especially against blood cancers, which are very, very hard to treat because you cannot just cut out a tumor because the cancer is in your bloodstream. It's very easy to metastasize. It's all over your body, so you cannot just like replace someone's entire blood. Right? This is just not really possible. And again, I'm an economist and not a medical researcher, so I might something which doesn't sound super smart. So if we have some biologists or medical researchers today in this webinar, it's going to be interesting how they're going to grill me. But what we can see, for instance, with immunotherapy is that we can reprogram our own blood cells to fight cancer cells. So we're basically getting an infusion with our own blood cells, which have been genetically usually reprogrammed, which helps us to slow down the growth of cancer and even kill it, or like in a combination with other therapies to kill it, which is fantastic because it used to be leukemia was more or less a death sentence, blood cancer. And now we can actually mitigate these things. Another issue, when we grew up, HIV/AIDS, there was a death sentence. That was seen in the 90s, 80s, and 90s as that big one problem. And still millions of people are dying of AIDS. So it hasn't been eradicated at all. But fortunately, there are new therapies which actually help so there have been patients now which have been so low on the virus count or viral count of the HIV virus that they have been actually declared as cured. And this is thanks to special antiretroviral therapies. It used to be when you were an HIV patient that you had to take a dozen pills 4 times a day. You basically just walked around with your pill dispenser, and now it's down to maybe 2 pills a day. If we look at what we can do against genetic diseases, hereditary diseases you inherited, which are often like very rare diseases. It's very hard to develop cures for this, and I'll talk a bit later why sometimes these treatments and cures are so expensive. But novel editing methods, so-called gene editing or the gene scissors, the techno bubble for it would be CRISPR-Cas9, allows us to really target certain parts of our genes, or certain genes, and reprogram them, like repair our own genes while we're alive. It's not just happening in vitro for an unborn baby, but it actually happens in live humans, that we can repair genes, which is fantastic, because basically it's a one-time procedure. And then if the procedure worked, you're cured of that genetic disease. This was science fiction 20 years ago, and now
for the rest of the people too, as well, I guess.
Yes. It's also most likely for these procedures is also that you can have children and you don't have to be worried that they might inherit it. It's still all fairly early, so sometimes it's not sure for how long these repairs last, but it looks very, very promising. Also, like one of the most common diseases in the world is diabetes, type 1 and type 2. And we have now continuous glucose monitoring. So diabetics can wear a small device. It's basically like a bit like Internet of Things device, which constantly measures their blood sugar and helps them to adjust their diet, but also their insulin intake, which really, really manages and mitigates the complications of living with diabetes, which is just like a massive improvement of life, especially quality of life. If we look at diabetes 1, this is something you can develop in your childhood. It's genetic. And it really, really helps these people to have a decent life. And another massive disease, hepatitis C. It's a hepatitis, I believe, doesn't have a vaccine, but we actually have now treatments. It's about an 8 to 10 week treatment, and then you're cured of hepatitis C. This treatment is also often under attack because in developed countries, it's very expensive, but it also helps you to overcome, usually in the past, the only way to deal with it was to get like a liver donated, and there's not much supply on the organ market. It's not a market, but in the organ donor system, there's not much supply. But now we have treatments, just a 3 months treatment, and you're cured, and you're allowed to keep your own liver, which is very good. Because basically, if you just lose your liver and you don't get a new one, it's basically a death sentence. So even like more simple fields, but when it comes to implants for people who lost their hearing, not just hearing aids, but actually implants for people who were totally deaf, to help them regaining most of their hearing capabilities. These are all inventions of the private sector, and they have been invented and marketed and mass produced because these companies invested billions often to just come to one invention, and they knew if they're successful, they can actually get a return on their investment, not just that they regain the money they invested, but also profit it. And let me just talk a bit about actually the economics behind this, because producing,
I think the most interesting part of it, because everybody's so in libertarians, we don't have a very good of an understanding or good measure of intellectual property. We don't like to talk about it all that much, but apparently, at least in pharmaceuticals, it is very important. And I think you have a couple of answers to at least some issues.
Yeah, so I mean, as a populist, you can of course say, well, these things have already been invented, and still these companies charge so much. Why don't we make a global law in light of COVID-19 that abolishes all patents for all pharmaceuticals? And then producing a drug, in most cases, it depends a bit on the drug, but in most cases, the mere production of it is fairly inexpensive. There's some certain drugs which are very complicated to synthesize, but in most cases, it's very cheap just to produce a drug. That's why the moment drugs lose their patent status, they become generics, and often they just cost a few cents. And it's usually just the retailers making some money with this. But if you look at the process of coming to a drug discovery, first of all, if you say, let's just make them all off patent as of today, that would be great for consumers for the next 2, 3, 4 years. But it would also lead us to a technological stalemate, because obviously these companies would go bankrupt. No one would start trying to innovate in the future because your investment is not protected through property rights. I mean, it's basically if you say, okay, I buy this piece of land, I start cultivating crops, and then you have a fantastic harvest. And then the society comes and says, this harvest is so good and these tomatoes are so delicious, let's just take them. It's better if we get it all for free. But if the harvest is not good, you say, oh, no, we leave that with you, your farmer go bankrupt. Right? I mean, this is about basically privatizing the losses, but nationalizing the profits in this case, which is like this case against intellectual property. So let me talk a bit about why we need to prevent this technological stalemate and this rhetoric against intellectual property. So in a lab, if you try to find one active substance, one molecule that helps to cure something or treat a condition, usually between 5,000 to 10,000 different substances are created in research facilities to find one that can actually do something new. And this process takes years and years, and there's so many biotech companies. So biotech companies are usually smaller companies that are spin-offs sometimes from universities, and they usually raise money through venture capitalists, or sometimes they also go to have an initial public offering, they go to the stock market, but really, really risky stocks, because most of these companies fail. Most of them never make it to level to actually bring a product to the market. And just to actually develop a patent-ready drug and to bring it to the market, you need usually 12.5 years on average of research. And you file for the patent much earlier because you don't want that someone steals your idea, right? So maybe after 3 years, you're already, okay, we need to file for this patent now, but then the clock is also ticking. Usually you have 20 years of patent protection, but already the moment you file, that clock is ticking. You might be able to extend it for a few additional years, but it's not that you only file for the patent once it's market ready. You have to file much earlier to protect it. And the average investment per successful drug that hits the market is 2 billion euros. So it's a massive investment, and I call it a shotgun approach, because you need to shoot in all sorts of directions to find actually one new active substance or molecule that can really help to cure or treat something or be better. I just also want to give one example, maybe before we go into some more details. Soviet Union, over the holidays, Christmas, New Year's, I spent some time trying to research. I really wanted to compare the medical innovations in the Soviet Union compared to NATO countries, or let's say Western liberal democracies, open societies. And I barely found anything. The Soviet Union was like over 70 years the Soviet Union existed. There was almost no pharmaceutical innovation. And the few things they were good at were doping, where they basically said, okay, we need to find something to like dope our athletes because communism needs to win gold medals. They were pretty good, or I would rather say ruthless, at finding substances and putting this into people because they had massive side effects. I mean, suddenly men on doping had like suddenly double D-sized breasts. I mean, the side effects were terrible. I mean, these people are still suffering from receiving these doping drugs. And there's like one heartbreaking story of a Russian scientist in the early 50s, still under Stalinism, whose daughter suffered from tuberculosis meningitis, actually. And there was no treatment in the Soviet Union for it. So this doctor managed through some back channels to reach out to Mayo Clinic in the US. And someone actually smuggled the drug into the Soviet Union for his daughter to be treated. And someone denounced this doctor, and Stalin sentenced him to death for daring to use capitalist drugs to save his daughter. So if we talk about capitalism is bad and exploits people, look at planned economies and how health systems look there, and there was no innovation. So just like as an intro, if you want to be a populist and talk against patents and against monetizing or monetary incentives to invent cures for diseases, let's just compare open societies and free market societies with planned economies. And we very clearly see medical innovation happens in capitalist systems.
Wow, that is an intense story, actually.
Yes, so if you want, we can start some back and forth, or would you like me to go on?
I think the first thing I would ask, so I would say, like, what are the main arguments against the intellectual property rights? Because you said it right, actually. So while you're having the product, then people wants to own it as well. But then when it's not good, then you're getting rid of the negative externalities for some reason. But also, I'm pretty sure you remember the Martin Shkreli case. So he wanted to sell the drug way over the price that it would be in the market. So one argument we can make is that having the intellectual property rights on, especially on pharmaceuticals, doesn't allow us to know what is the actual price of the drug. And since we care about the market procedures all that much, that is something that kind of messes with that. So what do you think about that? What would be your argument against it? Or
Yes, no, this is good. So if I remember Shkreli, yeah, Albanian name. If I remember that case correctly, he actually bought an HIV drug which was already off patent. He was the only one producing it. But and he increased the price a lot, but that drug was not patent protected anymore. So if I at least remember it correctly, this was just something like a very fringe drug, which is just produced by one company. It could be the same like a fringe spare part or a door opener, and only one company produces it and someone buys it and racks up the price. It's obviously very anti-ethical behavior, and I would not defend him. I would not drink a beer with that guy because it's really bad. I mean, HIV patients were really worried about getting drugs they need. It's just like, this is not nice what he did, but immediately another company could have jumped in and produced the same drug because it was off patent, if I remember it correctly. So the Shkreli thing is just about price gouging. That's like in days of Corona, we can say, imagine someone owns the last toilet paper roll and wants to have $1 million for it. But it's not that person owned the patent for manufacturing toilet paper. At least I think that was the case. Regarding prices, yes, we can talk actually a lot about prices and pharmaceuticals. It's of course hard. There are different ways to see how you can justify what sort of price for pharmaceuticals. So prices, obviously, of a market entrant can always be set as they want, right? They need to see, okay, what's the kind of the willingness to pay for customers. Yeah. And I mean, these things, iPhones, I mean, Apple is a very profitable company because they have something we want and they probably have a higher markup on it than some other consumer electronics producers. And we buy it. And obviously, if you're the first one inventing something and you have it patented for 20 years, you can charge more at the beginning. That is often done in negotiations with governments who pay for it or insurance companies. And if there's already, for instance, an existing treatment, and you say, well, our treatment doesn't do anything better, but we give you like a 20% cheaper drug, then the insurance company or the government health fund would say, yes, that's interesting. Or you also say, well, you know, this drug makes you walk again. You're paraplegic and now you can walk again. And if the average paraplegic at age 20 can walk again, means that this person can be actually productive, work for the next 40, 45 years, which of course is a massive value. And yes, it's a very crude economic look at it, but we live in a world of scarcity and we need to see how we approximate things. So I actually would like to talk about one case which really upsets a lot of people in the field of drug pricing. And that is a drug that entered the market last year. It's called, I need to read it because it's a complicated name. It's called Zolgensma, and that got approved last year. Zolgensma treats, it's a one-time treatment, so you only have to take it once, so it's being injected once. It's against a very terrible rare disease called spinal muscular atrophy. Usually children being born with this live between 1 and 2 years and then they die. And about 1 out of 10,000 newborns has this condition. And this new drug, which also involves some gene therapy, but what I talked earlier about, injects a virus which goes into the defect gene and repairs it and brings back the motoric muscle function, because basically you don't really have muscle functions when you're born with this. Your body just degenerates, which is extremely sad. And Since it's so rare, this disease, and it's only a one-time treatment. You know, if you, for instance, are diabetic and take insulin, it's like over decades. But this treatment, Novartis, the manufacturer, can only sell it to you once. And they charge right now $2 million for it, which is a very high price, but it costs them average $2 billion to develop something. And the market for this, the amount of patients who need it, is fortunately very small. We should be happy that there are only few people who need it, and now there's a cure for their disease. But since the market is very small, it's a very expensive product because the development of it is so expensive. So imagine there would be only a few thousand people who buy an iPhone every year. Obviously, then it would be much more expensive because it's just the design and production of it is much higher. Obviously, comparing a drug and an iPhone is a bit different because the share of material cost in an iPhone is much higher than of the drug compared to the total price. But just a bit to understand, a lot of things which are very sophisticated in society can be only cheap because there's so many consumers or patients who need it. For instance, the cure for hepatitis C costs in the United States about $60,000 these days. In Europe, it's more like $40,000 because unfortunately, much more people have hepatitis C. This is something that cures your life. And also it's important to say that these pharmaceutical companies usually give these drugs for a much lower price or even often for free in developing countries and low and middle income countries. So they make their money in very developed countries like the United States or Germany. I stop now and you can ask me something.
No worries. No, that's good, actually. It's good too. So we talk about how consumers are affected by these patents and intellectual property rights, but essentially, why should consumers care about companies' intellectual property rights at the end?
I mean, to be honest, if you're not a shareholder in a company, you don't really have to care. Or if you don't work there, you don't really have to care. You should be more interested and concerned about the institution of property rights. Mm-hmm. And I make the case that intellectual property rights are property rights because without these, we will get this technological stalemate. Basically, if we abolish now intellectual property rights, we'll probably see much less movies, much less creative productions. But what I'm more passionate about is technology and innovation, which is usually patent protected. We will see much less of this because why would you spend $2 billion if you don't make any money afterwards with this massive investment? And now I'm repeating myself.
No,
third time. So far, we can only cure 5% of known diseases, and that's not good. How do you want to tell someone who has a disease we don't have a cure for yet that we abolish intellectual property, and most likely because of that, we'll never find a cure for his or her disease? I mean, right now, everyone wants to see a treatment for COVID-19. Everyone wants to see a vaccine. If we abolish intellectual property rights now, maybe we don't come to it or not to a good vaccine. And this is my main argument why we should be concerned, because we're all getting older, which is great. It's not necessary that we're becoming too much healthier. If you like life and if you want to live long and if you want to live with your loved ones, you should embrace innovation and embrace intellectual property, because that's the incentive for innovators and capitalists to come together, researchers and capitalists coming together to figure out how to solve and overcome the challenges humanity faces, which is age, disease, hunger, rising sea levels, climate change. It doesn't matter. For all of these things, we need to have technological solutions because we don't have magic. That means we need to have technology and science, and that only comes with incentives.
All right. So we might have still people that they might be skeptical about intellectual property rights, but as you said, as an institution, we might be able to justify it, and even in terms of libertarian principles. But what do you think would be good policies that we can implement about intellectual property rights that would make both sides of the discussion happy?
Yes. Couple of thoughts on policies. First of all, we already have some sort of consensus or meeting in the middle when it comes to intellectual property, because patents in most countries last 20 years. So they expire. So to make this invention at some point available to everyone who wants to produce it. And probably extending patent rights would reduce the price per drug a company charges. Because if you know, oh, we had entered the market and we already developed it for 12 years, we only have 8 or 10 years to monetize. These are the 8 to 10 years we need to make your money. And of course, you charge much more than if you would know you have a return investment horizon of 50 years. But I'm not advocating for extending patent duration. We kind of found something in the middle, and that's already much less than what you have, for instance, for physical property, which you sort of own indefinitely, in most places at least. But I would rather advocate in terms of policy, let's be smart about this and not erode intellectual property rights further. If you're concerned about high drug prices, and that is usually what people are concerned and passionate about, which I fully sympathize with, we need to see how we can get more patients access to the latest medicine. This is something I would say also most people who work in pharmaceutical companies are passionate about, because they develop these products to help people. They need to make money, but they also want that people who cannot afford it somehow have a chance to access these. And there are a couple of ways how we can easily reduce the cost for pharmaceuticals without eroding intellectual property rights. So if we look especially at low and middle income countries, they actually often have massive taxes on pharmaceuticals. Imported pharmaceuticals from industrial nations have often special import tariffs, and usually most high-end pharmaceuticals come from the US, Germany, France, UK, Switzerland, Japan. Second of the pharmaceutical powerhouses, Belgium is also pretty good. And a lot of countries, as I said, have between 10 to 40% import taxes, which are paid by the patients. 40% is a lot of money. We always talk about the greedy pharmaceutical companies, but we don't talk about greedy governments. For instance, in China, the birthplace of COVID-19, Chinese patients alone pay $5 billion a year, $5 billion on tariffs for drugs they import. And if you think, I mean, when Corona started there, I mean, the first thing the Chinese government should have probably done is to stop charging import tariffs for medicines. And countries do not do this. I mean, the World Health Organization, today I called for the Director General to resign, so far he didn't do it. But the World Health Organization often suggests to scrap patents and go after the private sector and have like compulsory licensing, which basically means you force a company to give their patent away at a price the government mandates. It's basically eminent domain in the patent field, more or less, at a very bad price usually. They talk about these things, but they don't talk about very easy steps. Let's scrap import tariffs. Next step, value-added tax. So a lot of countries have a 25% value-added tax on drugs. Denmark has 25% on every drug being sold. I mean, they have a government-paid health system. Taxpayers pay the government to pay for their healthcare, but then in that, they still pay a 25% tax. And then it's like, oh, drug prices are so expensive. And why in the world is there a sales tax of 25% on medicine? This is insane. You often also have some other regional markups. I mean, in Brazil and Kenya, often these additional government-imposed markups, about 300% of the drug price. Now, we always talk about the poor and we're concerned. Yes, I'm very concerned. But we rarely talk about these governments marking up drugs by 300%. And that's, you can just solve that, yeah, because it's not that the government's invested in these drugs. They're just like, they just want to enrich themselves. And that's like on the cost of the patients and on the shoulders of patients. We also see that, for instance, Russia implemented a strategy that drugs have to be, drug imports have to be reduced because they want to be nationally sovereign. So they make imported drugs much more expensive. And that's at the cost of consumers. I mean, you see more and more, I mean, not right now, but Russian cancer patients flying to Israel or Germany because the cancer therapy in Russia is worse and actually got more expensive because a lot of these things which had to be imported got so expensive. Another way of actually reducing the price of drugs is, I already said it takes 12.5 years on average to bring a drug to the market. Parts of this is because of research necessary, but also a big part of this is because of government red tape. Oh, there are a lot of bureaucratic hurdles to bring a drug to the market. Some of them are very justified. I mean, we need to make sure drugs are safe. We don't want that patient take some random drugs and they all start dying. It's a complex thing. You put something in your body to force some change for the good. And of course, you need to study this. But for instance, the Food and Drug Administration in the US, or also the European Medicines Agency in Europe, they tend to be too slow. And we see this now, this year with the crisis. Suddenly a test, which usually takes 18 months, so 2 years to get approval, happened overnight. Roche already shipped their test kits before it got approved because the FDA told them, yeah, we fast track, we do this within 24 hours. So apparently it's possible if there's enough pressure. And by bringing drugs earlier to the market, you allow these companies to have a longer patent protection. That means they have additional years where they can actually have a return on their invest, which means the per doses price can be brought down.
All right, so I think that makes sense. So
may I add one more thing?
Yeah, sure, go ahead.
Also, another thing, what I really like to talk about is mutual recognition of approval bodies. So why does a big drug company or a small one, especially a small one, has to go to the Food and Drug Administration in the US to get approval, and then more or less they have to go through the same process in Europe, and then through the same process in Japan? This costs time, this costs money. Patients sometimes have years of delay. In Canada, for instance, it takes usually 450 days longer for a drug to enter the market than in the United States. If you have a lethal condition or a condition where you think you die, 450 days is a lot of time. And this is like, why can you not just say, well, if the Food and Drug Administration was faster approving it, it should be approved in every OECD country. Very easy. But they have and that would also create competition between these regulators, because you would try to file there where the regulator has the least bureaucracy and is the smartest and fastest, which then creates a system where regulators actually start to have to reform.
Right. So I just wanted to ask you about the elephant in the room. So what do you think about this pharmaceutical companies doing it about coronavirus? I've heard Bill Gates Foundation, they started clinical tests on humans. So it's been apparently going very fast as well. So what do you think? Do you think we will have a quick solution or something like a vaccine or drug that can cure corona? Or do you think these institutions that you said is very slow in their way of dealing with these problems are going to also be slow again, not going to help us really?
Yeah, I mean, the last 3 months, everyone was too slow, especially if you look at tests, because they were somehow out there, but then not approved. And I mean, we still need to digest what has happened in the United Kingdom and in the United States and Italy and Spain with these tests not being available, not being done. In Germany, somehow it worked much better. And I don't have a final opinion on this, because it's just requires some analysis of what all went wrong and how this could all go wrong. But definitely in the United States, the Center for Disease Control, CDC, which is based in Atlanta, Georgia, they initially wanted to have every test being sent to them. So tests were also sitting around for a couple of days. I had a friend, this test was sitting around for 5 days before it got analyzed. I mean, the results after this, of course, are not very precise and created bottlenecks. I mean, I, for instance, still didn't get tested in the United Kingdom. I'm pretty sure I already had it, but I don't have certainty. So I'm not sure if I have immunity now and can walk freely around and don't have to be worried. And that's important to bring people back to the economy, right? I mean, I'm fortunate I work on my computer all day long, so it doesn't really matter for the Fred GDP. But if you're seeing patients, if you're a medical professional, or if you just do something with your hands, so you work in a supermarket, it's really important to know, can I stop this self-isolating or not? And this seems to be this massive failure of public health. And I think it cascaded. So the first problem was that the Chinese government lied about the severity of this problem and the amount of cases. We still don't really know what happened in China, because the numbers China shows do not make sense if you look at the trajectory in the rest of the world. Then the WHO played covering up the Chinese Communist Party's numbers and failures. The WHO kept praising China, and they still praise China for the great work on corona. And the WHO told us there's most likely, even January 19th, they said most likely there's no human-to-human transmission of corona. And they also told us not to wear face masks because they don't help. Two lies. I mean, the WHO gets billions of dollars a year, mainly from Western taxpayers. And this institution has, like, even as a libertarian, I would say, having a public global body that helps us fighting pandemics. Maybe that's a role of government. Pretty good. Yeah, that's maybe you just have to sit it there. It's more like an insurance. It needs to sit there. Maybe, unfortunately, every couple of decades this happens. Or maybe we also had Ebola, where we just need to have some ready team that works globally, has access to every area, and like early wants everyone else to be prepared. And they were not prepared. They just covered up the shortcomings of the Chinese Communist government, while the Taiwanese government actually knew pretty quickly what was going on, responded appropriately, and no one wanted to listen to them because they're not allowed to be a full member of the WHO because Communist China vetoes them. So that is probably where we already lost 6 weeks of preparation. From then on, late January, most Western governments also did not do a good job in being prepared, like cutting immediately red tape, getting these tests out. The Korean government, for instance, did this really well. They had MERS, I believe, or one of these other respiratory diseases where a couple of people unfortunately died in Korea, and it was a big tragedy. And they basically set up systems to be much more agile when problems like Corona or COVID-19 arise. Yeah, now it seems to be a political thing who gets the first vaccine. It's probably going to be, pardon my French, shit show when different governments try to buy up the entire production of one vaccine producer. And we see that no one really currently tries to collaborate, but everyone just tries to, every health minister or head of government tries to be the first one buying big chunks of medical supplies or vaccines. Yeah, I mean, hopefully we have that soon. Hopefully also some of these other potential treatments, such as the malaria drug, which might be actually a way of treating it. I think it was hydrochlorine sulfate, that potentially works. I know that some countries have banned the use of it for COVID-19, even though there's some weak evidence, but there's some evidence that, I'm not even sure if weak evidence is a correct word, but there are some indications that it could work.
Inconclusive, maybe, yeah.
Yes, inconclusive, yes, thank you. Then there's patients and doctors should have the right to try this. And that's being endorsed in some countries and fought against in some other countries. Yeah, it basically, this crisis really shows the massive shortcoming of this public global health response system we have. It needs to be massively reformed, it needs to be depoliticized, and it needs to be put under the control of actually people who pay for this, which is taxpayers in liberal democracies, and not some communist apparatchiks in Beijing, which put the current Director General of the WHO from Ethiopia into his job.
All right. I guess we have a lot of things to say about coronavirus. Everybody's still talking about it, about the surveillance measures, about all of the regulations and so on and so forth. But let's keep it for another live session that we're going to have at Learn Liberty. Thank you very much, Fred, for joining us today, telling us about intellectual property rights, especially about pharmaceuticals. I think it was pretty informative, and I had fun, personally, at least.
So did I.
Great. Thank you very much for joining again. And this is the end of our first live session on Learn Liberty.
Great fun. Thank you so much.
Thank you so much. Have a good one.